Hello, everybody. This is Courtney with NCLEX Bootcamp. I am so excited that you're able to join us for our webinar today. We're going to spend the next 30 minutes or so together, and we're going to cover all the great resources NCLEX Bootcamp has to offer. So if you have just graduated from nursing school and you're thinking about taking the NCLEX, then this webinar is going to be for you. I'm going to take you over onto our live site and show you all of the really great resources we have available. So we're going to take a look at our Qbank, our predictor exams, and even our next generation case studies. So before we get started, I'll tell you a little bit about myself. My name is Dr. Courtney Olonichek. I am one of the nurse educators here at Bootcamp. I have been a nurse for, as of May, 14 years now, and for the past 7 of those, I've been a psychiatric mental health nurse practitioner. So most of my career has been spent in mental health. So before we take a look at our live site, I want to tell you a little bit about who Bootcamp is. So bootcamp.com, or NCLEX Bootcamp as we call it, has been developed by a team of nurse educators. We're all registered nurses, and we've all come to education from a big variety of different fields. We have nurses from OB and pediatrics and critical care, and nurses who have worked in ER, nurses who have worked in mental health. So we have pooled all of our expertise into a product that really looks and feels like the NCLEX to get you feeling confident and prepared as you head into this exam. And I think I, for one, will tell you, as well as the rest of my colleagues, that we really wished that we had something like this when we took the NCLEX, because we have compiled it down into that need-to-know information to help you cover all the topics you need to, so that you can walk into the NCLEX feeling confident and ready to tackle this exam and ace it with flying colors. So let's take a look at what we have. So the first question that I always get from students is, when they are thinking about studying for their NCLEX, they say, oh my gosh, where do I even start? Because you learn so much in nursing school, right? You cover so much content, and to think about reviewing all of it as you prepare to take your NCLEX can feel really daunting and overwhelming. So we heard you, and we have you covered, because we have some study schedules to help you with this process. So let's go over to our live site, and I will show you what these look like. So here is our NCLEX Bootcamp site. We have our navigation panel here on the left that you can see. And so if we scroll down, you will see under resources, there is a little tab here that says study schedules. So if we take a look at that, you can see that we have 1 month, 2 month, and 3 month study schedules. So you can pick which one works best for you depending on when you're scheduled to take the NCLEX. So if you just graduated in May, congratulations. And maybe you're thinking about taking your NCLEX in July, you'll probably find a nice fit with our 1 month study schedule. So we can take a look at what that looks like. And as we pull it up here, you can see that this is broken down week by week and day by day to make sure that you cover all of the content that you need to before you take the NCLEX. So it's going to take you through everything we have on our site. So you're going to start off with our next generation course, and then you're going to start with our readiness exams, and then you're going to work your way through all of our case studies and all of our standalone questions, so that you don't miss any of the content and that you are fully prepared to tackle that NCLEX. So you'll notice that we tell you to start out with our next generation course. So if we go back to our main page here and you scroll down, you will see under review, there is a button here called our next generation course. And this was developed by Dr. Emily, and you might have seen her face on our YouTube page, our Facebook page, and in a lot of our case studies if you've done any of our case studies that we have on our site here. But she has created this next generation strategy course, because the next generation NCLEX is fairly new, and so a lot of people feel a little intimidated by this because they don't know quite what to expect, right? But if we go down and look, she will tell you exactly what to expect. And so she's going to cover the basics of the next generation NCLEX. She's going to talk about specifically case studies and how to approach them, and then walk you through an entire case study so that you can learn how to approach these case studies in a way that will really help you be successful in answering these questions. All right, so if we go back, I want to show you our Qbank. So we have a very comprehensive test bank. It includes about 1,500 questions because we really believe that you should be studying smarter and not necessarily harder. And of course, you need to study hard for the NCLEX, but you don't need to take 10,000 practice questions to be ready to take this exam. We say you need to do about 1,100 as long as they're good, high quality questions like what we've written for this question bank. So these questions are going to cover all the topics you need to know for the NCLEX. So we have gone through all the textbooks, all the resources, and pulled out those really testable points that you're likely to see on the NCLEX. And then if we go over to our live site, you can customize your study experience based on the questions that you need to answer for the day based on the study schedule that you've chosen. So you can get to our question bank from two places. You can either go to, on the left-hand side here, you see it says standalone questions, so we can click on that. And here we can create tests by subject area. So say we want to do child health or adult health, we can go over here to create a test and we can pick how many questions we want to see on that. The other area that we can get to our standalone questions from is over here, this big purple button where it says create a test. And I like this one because you can really customize the test that you want to take from this area. So you can specify if you want to take it in tutor mode or timed mode, and you can pick from the question pool. So you can choose to answer unanswered or unused questions, which are going to be questions you haven't seen before. You can choose from your tagged items, which I'll show you what that means in just a little bit. You can select from all the questions, which means you might get some questions in there that you've already seen before. And then from there, you can specify what subjects that you want to cover. So you can say, well, I want to do maybe some case studies and some adult health questions and maybe some critical care. And then from there, you can go down and select how many questions you want. So maybe if you want to do them 20 at a time, you could say, I only want a 20 question test. And you could generate that and it will pull questions from all of these areas. So I want to show you what one of these questions looks like. And I'm going to actually go to my bookmark questions because I've pulled out a few that I think would be really good for you to see. So I'm going to start this test and it's going to generate them based on my bookmarked questions. And so you can see that these questions are going to look really similar to what they will look like on the NCLEX. And we do this because we want you just to focus on the content. We don't want you to be surprised that the test maybe looks a little bit different when you go in to sit for the NCLEX, or maybe it's worded a little different. So we've paid a lot of attention to detail to make this look and feel like the actual NCLEX exam. So since we're here together, should we answer a practice question together? We might as well get some practice in while we're here, right? So let's do this question. So this is a nurse who is assessing a client diagnosed with major depressive disorder. And they had a dose of fluoxetine that was just increased yesterday. And now we're being asked which assessment finding is most concerning. So this is a prioritization type question, right? So all of these assessment findings could be concerning, but we're looking for the one that is most concerning. So before we look at our answer options, let's ask ourselves what we know about fluoxetine. So I know that this is a selective serotonin reuptake inhibitor. And we use those to treat depression and anxiety and OCD and eating disorders and all kinds of things in the world of mental health, right? So what do we know are some common side effects of fluoxetine? I know that GI upset is a big one, like nausea and diarrhea. I know that sexual side effects are really common with SSRIs. Headaches can be really common. And I already see those two as my first two options, nausea and headaches. So are you very concerned about these? I'm not too concerned because these are pretty common side effects. We see these a lot. Let's look at our third option, which is a continued report of low mood. So their dose was just increased yesterday. So what do we know about how long it takes SSRIs to start working? They can take a couple weeks, right? So is it surprising that their mood is still low if their dose was only increased yesterday? No, I wouldn't expect it to be any different. So I'm not too worried about that. But what is the big concern that we think of when we think of antidepressant medications, specifically SSRIs? I worry about serotonin syndrome, right? So that is something that can happen if we block too much serotonin, and that can be life-threatening, right? And so what are some symptoms of that? I know that sweating is a symptom of it, muscle rigidity, fever. And so this beads of sweat on the forehead probably needs some further assessment, right? This might be an indication of serotonin syndrome. So I like that answer option. So what we're going to do is once we've selected our answer, we're going to go over here and hit submit. and this is going to pop up all kinds of stuff. And this is really where the learning happens. So let's take a look at what we have here. So if you go down to this kind of green tagged box right below our answer options, you're going to see a couple of things. The first is going to tell us how much credit we got for this question. And so this was a single best question, so we have 1 out of 1 points. Now, if this was a select all that apply question, this might look a little bit different. So it might say like, oh, we got 4 out of 5 points on this question if we only selected 4 out of 5 possible correct answers. And then if we go a little bit further to the right, we're going to see the percentage of people who have answered this question correctly. So this is pulled from all the users that are using our Qbank. So this is a good indicator of how difficult a question is. So if 90% of people are scoring correct, that's probably a fairly easy question or easier question. But if only maybe 30% of people are getting the question correct, maybe it's a little bit more challenging. And then we have the scoring rule that applies. So this would be how the NCLEX would score this question. So this is a single best question. So we have that 0-1 scoring rule. And then we have time spent. And this is also another really important piece of information to pay attention to, because we know that you have a maximum of 5 hours to complete the NCLEX, right? And we know that you can get up to 150 questions. So if we do the math, that would be about 2 minutes per question, right? And so we want to aim for that average of 2 minutes per question, because if you were to get all 150 questions on your NCLEX, we want to make sure that you have time to finish that exam, right? So we always want to keep an eye that we're averaging about 2 minutes per question. All right, so now if we move over to this box on the right-hand side, you can see just above my head here, we have a nice image depicting what serotonin syndrome might look like. And so we've included a lot of visuals throughout our answer explanations, because we know that not everybody learns the same way. Some people are visual learners, and some people maybe like to read more to better understand what's happening. So we have both. And here we can see a picture telling us some of the symptoms we are likely to see with serotonin syndrome. So we can see that we might have tachycardia, hypertension, muscle rigidity, and then here's that fever, sweating, and shivering right here that we picked as our correct answer option. And then as we go through and we can read as about why the correct answer was correct, and there might be some more photos embedded in here just to kind of help us better understand what's happening or the concept that we're explaining. And you'll notice that all of our answer rationales, correct and incorrect, are limited to 250 words or less. And we do this because we have pulled out just the information that you really need to know to understand this concept, because we know that you have a lot of content to get through. And so we don't want to overburden you with having to read a lot of detailed explanations, but we've just included that essential information that you really need to know for the NCLEX. So if we keep scrolling down, you're going to see an explanation as to why our incorrect answers are in fact incorrect. And that's going to be a really important learning opportunity as well, because there's a lot of learning built into this. So even if you got the question right, I would encourage you to read these as well. And then if we keep scrolling down, you're going to see this section that all of our questions are going to have called the key takeaway. And this is really important because ultimately nobody can predict the questions or the exact questions that you're going to have on your NCLEX exam. But we can predict themes, right? Because if you get a question that's asking about safety and SSRIs, chances are they're going to be asking you about serotonin syndrome, because that is one of the biggest safety concerns that we know of when it comes to SSRI medications. So we want you to understand the concept of serotonin syndrome. So if you know that clients on SSRIs should be monitored for this syndrome, and these are the potential symptoms that might alert you to the fact that serotonin syndrome was happening, you're going to be able to answer all kinds of questions about serotonin syndrome correctly, even if it's not the exact same question that you got on the practice exam. Okay? So let's keep going down. We have a few more features I want to show you. And this next one is called Ask Bootcamp AI. And so this is an area where you can put in some prompts. So you could ask for a little bit more information about maybe why option 1 is incorrect, or maybe some more information about why option 4 is correct, just to provide you a little bit more context, or if you want it described to you in maybe a little bit different way. And if that doesn't answer your question, or you have some feedback on the item, you can go to this box below it, which is kind of hidden behind my head here. And it says contact our team. So if you click right here in this box, it's going to pop up a chat, and it's going to to tag the question that you are making a comment on. And then you can ask your question or leave your feedback, and this is going to go to one of the nurses on our team. So it will be answered by an actual nurse, and they'll get back to you within a couple of hours. So if you have feedback or questions, don't be shy to use that feature as well, okay? And then the last thing I want to show you is our tagging system. So if you look at the very bottom of your screen, you're going to see this red tag, yellow tag, and green tag. And so these are really helpful because it allows you to tag items that you want to come back and review, or items that you feel like maybe you're not as strong on yet. And so what happens is, because we answered this question correct, it's going to auto tag it as green, saying we've mastered this topic, we know this information. But if I maybe guessed on this question and I just got it right because I was lucky and I don't really know this information, I could go and tag that as either still learning or reviewing. And so that way, when I go back to make an exam, so if I go here, I can click on that I want to use questions that I've tagged that I'm either still reviewing or information I'm still learning. And so that's going to help me tag the information that I feel a little bit weaker on, and then I can do a focused review of it in the future when I'm creating another test. All right. So the next thing I want to show you is our case studies, because we know that the next generation NCLEX has case studies. And so we have a lot of them for you to practice with. We've got 50 of them, and that doesn't include the ones that are in our assessment exams as well, or our predictor exams. And so our case studies all have those written rationales for the questions that you saw with our standalone questions, and they also have these video walkthroughs, which means each question of the case study has a video that goes along with it. It's less than 5 minutes, so you can get through it pretty quickly, but it is a video of one of our nurses here on the bootcamp team talking about this case study and helping you understand how we arrived at the correct answer, and teaching you how to think about these case studies like a nurse and in a way that will really help you be successful when you take the NCLEX. So our students have said that they really, really enjoy these, and they feel like they're a game changer and they're really helpful. So let's take a look at those. So if I click on here, now you can get to our case studies from a couple different areas. So you can, when we go to create a test, you can select if you want a case study in the exam you're creating, or you can come down to here under study, and they're going to be in this left-hand panel. So if we click on here, you can see all the case studies that we have for you. So they cover adult health, mental health, OB, pediatrics, critical care. So there is lots of case studies for you to practice with. And if we open one of those case studies up, you can see that this is going to look very similar to what it will look like in the live NCLEX environment. So each case study we know has 6 items associated with it, and you will get practice in all the different item types you might see on the actual NCLEX. So here we have a highlight type question. If we click through here, we have a matrix type question. We have a drag and drop question, and of course all of our data tabs on the left-hand side that you'll take a look through as you're working your way through this case. So just to show you what this will look like, I am just going to drag 3 of these over here, and then I'm going to hit submit. And this is going to look very similar to what we saw with the standalone questions, right? It's going to tell us how much credit we got, average points, the scoring rule, and the time we spent on that question. And then if we scroll down, here we're going to see that video embedded right in our explanation. So in this case, it's only 2 minutes and 20 seconds long, and Dr. Emily is going to walk you through and tell you about how she conceptualized this case and how she was thinking about it to arrive at the correct answers. So if we kind of scrub through here, you can see her explaining why these correct answers are correct and why the incorrect answers were in fact incorrect. And if we keep scrolling down, you're going to see that same written explanation for those who like to learn by reading. We're going to have images embedded through here so we can see the concepts that we're describing. And again, we're going to have those same key takeaways at the bottom saying this is the main concept you need to understand to really grasp the concept that's being tested in this question. All right. So the last thing I want to show you are our readiness exams. So these are our predictor exams. And so these have 100 questions each, and they will give you a score of how likely you are to pass the NCLEX. So these readiness exams are not just a random pile of practice questions. These were meticulously selected and written to match up with the NCSBN test plans. So out of those 100 questions, 14% of those are going to be physiological adaptation, 18% is going to be management of care, 13% is going to be safety and infection, and so on. And we do this because it gives us a lot more accurate prediction of how likely you are to pass the NCLEX, because the questions that you're going to see on these readiness exams mirror this NCSBN test plan that the actual NCLEX exam uses. So let me show you what these look like. I'm going to click on here. And you can see that we can get to those readiness exams over here under our study tab. They're right here under readiness exams, and you're going to see there's 4 of them. So depending on what study schedule you selected, whether it was 1, 2, or 3 months, these readiness exams are worked into those schedules at different points so that you can test your readiness. So in theory, you should see your prediction score go up as you work your way from readiness exam 1 through 4. So we can take a look at what these look like. So I'm going to click on this. And these are going to look very similar to the standalone questions in our Qbank or in our practice environment. The only difference is going to be that when I start clicking on these and answering them, I'm not going to get a rationale because this is going to simulate the NCLEX environment. So I'm just going to click on a few of these so that we can see what this looks like. And obviously, if I was taking this for real, we would go through all 100 questions. But since you probably don't want to sit and watch me click through 100 questions, we'll just click on a few and then we'll end it. Okay, so if we were at question 100, then we would click end. And then this is just popping up and saying, are you sure you want to submit your exam? Because there are some questions that I've left unanswered. So I'm going to say, yes, I'm sure. And it's going to generate a nice report for us. And so unfortunately with my random clicking, I have a low chance of passing the NCLEX, but hopefully that would be a little different if I had made it through the whole exam. But it's going to give you a score, and it's going to tell you whether you have a low, borderline, high, or very high chance of passing the NCLEX. And so it's also going to give you a lot more information that you can take a look at to help guide your studying. So unfortunately, I only scored 2%, but others who have taken this exam, or everybody that has taken this exam on our live site, they're scoring about 65%. And you can see scored and total points, and then you can see the time you spent per question, because remember, we want to aim for about 2 minutes per question. And if we keep scrolling down, we're going to get a nice note from Dr. Emily telling us our likelihood of passing the NCLEX, and then a few tips of what we can do to help improve our chances. And then if we keep scrolling down, we're going to get a breakdown by subject. And so this is really helpful for focusing our studying as we move forward. So say I did really great in pharmacology, I scored like 90%. I'm like, ooh, I know my pharmacology, I'm doing great in it. But maybe child health wasn't so good. And maybe I say, okay, I need to spend some more time in pediatrics because I didn't score so well in that area. And so then I can use that to create a more focused test when I'm practicing in the days to come. And then from there, we can get an even more detailed question breakdown, which is going to tell us which questions we got right and which questions we got wrong. All right, so the last thing that I want to show you, which is really important, is over here under our review tab, we have this one that says performance. So if I click on that, it's going to give me some information. And this is really important to keep an eye on when we're looking at how ready we are to take the NCLEX. So you can see up here, Dr. Emily's telling me that I've met 0 of 2 overall targets. So there's 2 targets we want you to meet that will help us tell you definitively that you are ready to take the NCLEX. And that is the first one being your overall score. And so this just means that of all the questions you've answered in the Qbank, this is your percentage right that you're getting. And so we want you to be scoring over 61% correct. And then the other target that we want you to meet is the amount of questions tagged. And this refers to how many questions that you've seen in our Qbank. And the reason that we do that is because say you come in and you're like, I really like child health. I'm great at child health. I know everything there is to know about child health. And you come in and you do all the case studies on child health and all the standalone questions on child health, and you're scoring at like a 90%. And we're like, oh, that's great. But you're probably going to get other questions outside of child health on your NCLEX. And so we want to make sure that you're seeing a really broad variety of topics and you're still scoring over 61%. So in this case, we say that you need to probably that you need to meet over a little over 1,100 questions for us to definitively say you've seen a wide variety of topics and we're confident that you've covered all the information that you might see on the NCLEX. And so if you meet those two targets, we can definitively say you're 99% likely to pass the NCLEX if you're meeting both of these. So this is a really helpful page to keep an eye on as you're studying. And then if we go down even further, we can see performance by subject. So say maybe we're doing, like I said, really well in child health, but then we come down to critical care and we're thinking, oh, I probably need to spend a little bit more time and attention here because I'm not scoring so well in this area. And that's, again, going to help you focus your studying as you move forward. All right, so I am going to leave you with some additional resources. So for those of you who are watching us in the Facebook group, you're already aware of our Facebook study group because you're in it right now. But if you have any friends or cohort members who are also studying to take the NCLEX, make sure you hit that invite button down here in red so that you can invite them to join our Facebook study group as well so that nobody misses out on all the great resources that we have available. We do live weekly webinars here in our Facebook study group. They're also posted over on our YouTube page. And so we cover all kinds of topics relevant to NCLEX. So we have webinars on approaching next generation case studies. We have webinars on delegation and assignment making, prioritization. We do a study group where we tackle several standalone questions together. So you can always find information on when those webinars will be on our Facebook page. You can also find us on Instagram, YouTube, TikTok, all the social media platforms, and I'll give you those links in just a second. But if you found this webinar helpful and you think that you would like to use Bootcamp, you can start studying for free. And if you want to upgrade, you can get to that page here, and those links will all be attached below. And just for attending the webinar today, you do get 25% off. So that code is going to be webinar25. And so when you do choose to upgrade, you can enter that code in and it will give you a 25% discount. All right. So here is where you can find us. We love to hear from people. So if you just want to pop in and say hi, we would love that. If you have any questions, if you have any feedback, if you want to tell us about how your exam went, we love to hear from people. So make sure that you drop us a comment and let us know how things are going for you. And once again, if you recently graduated with the May semester, we want to say another big congratulations to everybody who's recently graduated. We know it's taken a lot of time and work to get here. So a big congratulations from all of us here at Bootcamp. So I am going to leave you here with a list of links of where you can find us, and stay tuned for information on next week's webinar, which will be covering everything you need to know about next generation case studies. So stay tuned for that. All of our previous webinars are archived on our Facebook page and our YouTube page. So if you missed out, don't worry, you can view them at a later time. So I want to thank you everybody who's joined us today. I really appreciate it, and I will see you again next time. All right. Take care. Thank you. Bye.